Four things to consider before moving into an aged care facility include getting assessed. You need to be eligible to move into an aged care facility. The ACAT team, standing for Aged Care Assessment Team, will come to you free of charge to assess your mental and physical ability. They are generally health professionals and will ask you questions about your mobility and your general health. Once you have your ACAT assessment, which will determine the level and type of care needed, you can then start looking for your facility. The next step to consider is to find a suitable facility. Research, research and research. Not all facilities are the same. There are many differences, different care levels, different proximity to loved ones. It is advisable to visit a few to make sure that you're comfortable with the aged care facility you're looking at moving into. The next step is to work out the costs. How much is your move in aged care going to cost? There are many fees and many tricky fees to calculate. The accommodation payment, for example, can be funded three separate ways. Once you're in the facility, there are ongoing costs, like the basic daily care fee, means tested fee, or additional services fee. There are many fees and costs that need to be considered, and worthwhile talking to a professional about. The last step is to seek advice. Aged care is a tricky landscape. There's lots of variables, but with the right advice, we can make this difficult and emotional time a little bit easier for you and your loved ones.